What are the guidelines for an opioid overdose? It's an excellent question, and the first thing to do is to make sure that the environment is safe. Any bystander needs to make sure there's no danger to them, because obviously that is counterproductive. So to make sure that the person who's having an overdose, if they're awake, then they can just keep a close watchful eye on them to make sure that there's no impairment of their level of consciousness or slowing down of their breathing. However, there's a decrease in their level of consciousness. If they're not responding to you, if they're falling asleep, the idea is to wake them up. You can call their name loudly. If they don't respond to verbal stimuli, then the next thing to do is to give them a painful stimulus, which is generally a knuckle into the sternum. That's a safe way that will wake up a lot of people from an overdose, and that might need to be repeated. Going further down the spectrum though, a person in an active overdose can lose the ability to breathe, and the obvious signs are discolored skin with blue or purple discoloration, but this is a stepwise approach. At first they're pale, then they would turn green colored sometimes, depending on their colored skin, and then finally to a blue ashen color. That's an obvious sign of a respiratory emergency. In that situation, to get them down onto the ground on their back, and to call for help, 911, and get your hands on a Narcan or a Naloxone kit. In that kit, they have a barrier mask for a respiratory assist. So this is mouth-to-mouth respirations. The emergency is that they've stopped breathing. We need to give them rescue breaths. And in the kit, which you'll see in another video, which I will show you in there, what's in the kit is a barrier mask. So this provides a safer, more sanitary way of giving mouth-to-mouth. It's not needed, however, if this is a loved one and they're stopped breathing, obviously mouth-to-mouth is the first thing. The next thing is to get the Narcan or Naloxone kit. It's the same thing, it's the same drug, just different names. These come in different forms, as a intramuscular injection, which is a needle, or the other one is easier to give, and this is a intranasal spray, and it's just sprayed up the nose. Then to roll them on their side in case they might vomit, that's called the recovery position. And then to keep a close eye on them and to go through this again, to keep an eye on their mental status, to keep an eye on their respirations, because they could go back into lack of breathing. Finally, to get first responders there, to call 911, as I said earlier, and to keep a close eye on your loved ones. So to summarize, what are the guidelines for an opioid overdose is to watch for various levels of sedation in which the person progresses from lack of verbal stimulation because they're falling asleep, unconscious, lack of painful stimulation, no response to that. That suggests that there's imminent respiratory failure. To get them on the ground, on their back, into a position so you could administer the naloxone or mouth-to-mouth respirations, preferably mouth-to-mouth first, followed by the naloxone injection, and to get them in the recovery position on their side in case they vomit, so they're not aspirating or choking on the vomit, and finally getting help from an emergency medical responder.
If you or a loved one are looking for help with substance abuse, call our 24/7 helpline at 1-800-615-1067. A caring addiction advisor is awaiting your call.